Hello and welcome to Panorama. I'm Mark Glasgow, and coming up on our program tonight, we want to talk about our four-legged friends in the animal kingdom, and joining us to do that from the Wooster Animal Clinic is Dr. Mark Yacapraro. And Mark, welcome to our program.
Thanks for having me.
I want to talk today, try to bring people an up-close and personal look at why you take your pet to the vet for stool samples and blood work and vaccines and all this stuff, because it's one thing to talk about a tapeworm. It's another thing to actually see A, how your pet gets it, and B, how that thing looks in the body. Yuck.
Yeah.
I can tell you from looking at these pictures ahead of time, it's like, wow, I didn't know a tapeworm looked like that. I mean, it kind of brings it home. It brings it home as to why that constant checking and preventative measures that you can take a lot of times are so worth it.
Yeah, and it's tough for people to kind of understand, okay, when we go to our doctors, we don't take a stool sample to check for worms. And a lot of the medical conditions that pets and people get are the same. Mm-hmm. Well, why is it important to take a stool sample or have your pet evaluated by a veterinarian for worms? It's because it's a much more common problem in pets than it is in people.
Okay.
So a lot of these things that the pet owner can't see, can't appreciate that those potentials are there. It's hard to understand, why am I bringing a stool sample in? My dog never goes out and is around other dogs where they could get worms, or they don't do this, or my cat's inside only. Well, it's amazing how often these pets that have a nice, comfortable life get parasites, and it's very common. Mm-hmm. Whether it's an inside cat, inside dog, doesn't matter. They pick these things up.
Yeah, and I think the folks at home will see that as we go through. You made the comment before going on that animals get this because they eat dumb things, and there's stuff as we're going to go along here that you wouldn't think. I mean, the dog ate a stick. Okay, well, guess what? The worm was in that stick, and that was the start of a process. So
that's right. So it's all related to what they eat, what they ingest. That's how they pick up these things. For instance, I think the first one we're going to talk about, the tapeworm in a cat.
Yep. And
one of the most common ways a cat gets a tapeworm is a flea jumps on them, and a flea or a cat is very good at grooming.
Okay.
So they feel that flea. Well, as that cat grooms, it sounds strange, but a lot of times that cat will eat that flea. Well, a lot of fleas carry a tapeworm in a microscopic form that develops in the flea, and then when the cat eats the flea, a while later, that cat has tapeworms.
Yeah, so the flea doesn't survive being eaten, but the tapeworm does.
The tapeworm does, okay. And that's how it gets into the cat.
Okay.
So this is how, okay, my cat never goes outside. How could it get a tapeworm? Well, at some point a flea got on it, it ate the flea, and then the tapeworm developed. And the tough thing with pets is they can't talk, they can't tell you. A lot of times they'll carry these parasites a long time without you knowing it, and without a stool sample or an exam,
okay.
It's just hard to figure it out.
Yeah. Now, we should say, Mark gave us a book that beautiful pictures. And you know how they say computers are a wonderful thing when they work? Well, ours didn't like it very well. So we're doing this the old-fashioned way. So Mark did due diligence and tried to make us look professional, but guess what? We're doing it the old-fashioned way today, old school, and we're just going to hold this up, and we're going to make Jeff work, which will be refreshing to see, because it's sort of like those albino alligators. You hear about them, but you never actually see one. So we're making Jeff work today, and we're going to hold these up, and you can take us through. And so, Mark, what are we looking at here?
So what you're looking at there is how a cat gets a tapeworm, or one of the ways. There's two ways a cat can get a tapeworm. This kitten has a flea on it, and as I mentioned a second ago, the flea carries a very, very small tapeworm, and the tapeworm has to go through the flea so that it can mature. As the cat eats the flea and the flea is digested, that worm is released into the cat, and that little tiny microscopic tapeworm turns into a giant. And it's amazing how big these tapeworms can be. A large adult cat can have a tapeworm. It may not necessarily make them sick.
Okay.
If a kitten gets a big tapeworm, it can really affect them.
Okay.
So this is kind of one of those things. Well, why would my cat get a tapeworm? Well, they eat dumb things,
Okay.
and that's how they pick this kind of thing
I
up.
want to show this other photo, especially the big one on the bottom, and I'll try to get it. Yeah. When you talk about big worms, that is a single tapeworm. Is
Those
that right?
tapeworms can be huge, can be 12 inches long, and you look at a little tiny kitten, it carries that. It steals a lot of their nutrients. And a lot of times when a pet has one worm, a lot of times they'll have more than one. So if you've got a kitten that has maybe roundworms and hookworms too, that really is stealing that kitten's nutrition, gives them diarrhea, just makes them feel poor.
Okay.
Very, very easy thing to treat. But those parasites can really drag an animal down.
So there is something to be said for if you've got a kitten that you're feeding and it's eating and everything appears to be going well, but yet it isn't gaining weight or maybe even losing weight, that it is worms.
That's very common. It's one of
Okay.
the most common, and it's kind of the same in puppies too.
Okay.
You've got a puppy that's losing weight, not gaining weight, constantly has diarrhea. That's another tapeworm there. That's kind of an interesting
Yeah,
one
let's
too,
talk about
because
that
that is kind of the same idea, especially for a cat. So here's a classic. This is a different kind of tapeworm, but this is when your cat or your dog can get these too, is when they're hunters. And whether it's mice or small rodents or whatever, they ingest that rodent that carries the microscopic tapeworm. And over a period of time, that tapeworm develops. So this is your classic, well, my cat never gets outside. Where's it going to get a tapeworm from? Well, mice can get in the house.
Yeah.
Cat eats the mouse. That's where they come from.
Okay.
And so it's just a very common thing because cats do their thing.
Okay. And I'm going to do the same thing. We'll flip around here so that you can really see the scope of that worm. And that's just amazing. Now, that is in its belly there? That's in the stomach?
It can be, a lot of times with a tapeworm, it's in the large intestine.
Okay.
If they get a tremendous amount, they can move right up into the small intestine and stomach. And sometimes a cat will have so many of those, they'll vomit a tapeworm up that big. And it's hard to believe. It's amazing how big they can be.
And that is a living creature there. When
It
we
is
say
a
worm, that's not a...
No, that thing is alive. It's attached to the inside lining, and it's stealing nutrients. And some of the other parasites are actually a little more damaging than the tapeworm.
Okay.
That actually cause more damage.
Okay. I know roundworms was one I think we want to talk about.
Sure.
Our treatment of worms, is that can that be a proactive or is it always a reactive?
Okay, so certain types of worms, it's proactive. Like if you have a puppy that's 6-8 weeks old, we just worm them.
Okay.
Just worm them. Because a lot of these, including roundworms, that can be picked up from the milk.
Okay. Yeah,
Or
we're gonna
through
see that on
through the placenta as a kitten or a puppy's developing. So a puppy or a kitten can get roundworms just by drinking milk or just by being born. So a lot of those animals at 4, 6, 8 weeks, yeah, we're just going to worm them. Even if they don't have the worm, it doesn't hurt them.
Okay.
And it just is a way to keep them healthier. So you're right. Some is proactive. You just worm them.
Okay.
And I will say on some cats that it's very difficult to get a stool sample on them. If they're out hunting, doing their things, we'll worm them twice a year, assuming they've picked something up. Maybe we can't evaluate their stool, but we'll worm them just to be sure.
Okay. Now, we'll go back to that drawing, but you see the kittens nursing there from mom. Now, the fact that they get it, does that mean mom has it?
That's right. And what happens is even a female that is well cared for has been wormed numerous times. The stress of pregnancy brings out latent worms.
Oh, okay.
They can form a cyst in their muscle. And that's a good point because you have mom, and it's the same for a dog too. It's been well wormed, well taken care of. How is this dog going to give worms to the puppy when it doesn't have worms? It doesn't have active worms. But the stress of all this brings out a dormant stage in her muscle, is transmitted either through the placenta or through the milk. So whether mom doesn't show any signs of worms, those puppies probably have them, those kittens probably have them. You want to go ahead and worm those.
Okay. And again, here's a close-up shot, a better picture, my gosh.
And there can be one or two, there can be so many that it can actually cause an intestinal blockage. There's another form of parasite called a hookworm that actually has kind of teeth structures, and attach to the inside lining of the intestines that actually suck blood.
Okay.
So roundworms are bad. Hookworms are probably worse.
Okay, and I think we're going to show the hookworms. So when an animal has that many, as what we were showing there, I mean, how can it even function?
It's difficult if they're small, and
If
until
the animal is small,
right?
Okay.
Until they get wormed, those can be fatal.
Okay. Wow.
Those can be fatal.
Okay. Do we want to do whipworms?
Yeah, we kind of
Okay.
covered that.
All right.
There's a good
There's
one
the
to do.
hookworms.
There's a
Okay.
hookworm.
All right. So we'll start with this. Now these are the ones you said have like a
They
almost
have
a
they
teeth
kind of have
appendage?
a tooth type structure, and they actually emit a anticoagulant. So when they attach to the inside lining of the intestine and start drinking blood, they form an anticoagulant that allows them to keep drinking blood and the blood not clotting.
Okay.
So you can imagine if you're a
Like a
puppy
mosquito?
if you're a puppy or a kitten and have a ton of those, I'm going to steal your nutrition. I'm going to steal your blood. I can make you anemic. I mean, hookworms are a difficult worm, and there's actually, not to scare people, hookworms can be transmitted to people.
Ooh, okay.
Now, they do a little different in people, but they can be transmitted to people.
Would it be from picking up the feces of
What
the dog?
usually happens is the pet has the worms, goes potty in a sandbox or on the beach or wherever,
Okay.
and someone steps on it.
Ooh, okay.
The parasite will actually attach to the skin and migrate through a person's skin.
Okay.
So, not trying to make it over dramatic, some
Sure.
of these worms can be transmitted to people.
Mm-hmm.
Hookworms through the skin, and roundworms, we already talked about those.
Mm-hmm.
When you have children around, if they are exposed to roundworms, that parasite can actually migrate into their eye.
Oh, wow.
So again, I'm not saying this is an everyday
Oh, sure,
problem,
yeah.
but if I have a kitten that I think has worms and I see a child standing in a room, you just worm them just to be sure. You're trying to protect and you know, good hand washing and all those things. That doesn't mean your child can't hold your kitten or your puppy, but good hand washing techniques, keep them away from the feces. Doing those kind of things will protect the child, and getting ahead of these things and getting them wormed is very important.
Does the human immune system do any better job than the animal's immune system of killing them if they enter the human's body? Or
It's all about what a parasite is designed to live off a host but not cause too much damage.
Okay.
That's how a parasite survives. And what happens is when some of these parasites are transmitted to people, some things we have better immune systems that can kill them off, but sometimes we overreact to them. For instance, if that worm gets in our eye, it can cause blindness.
Wow.
So it's all related to how that parasite likes that particular host.
Okay.
There's some parasites that people get that pets aren't going to get, and vice versa, but there's some that can cross.
Okay.
And that's the whole point of getting ahead, worming them, keeps everybody healthier.
Okay. And going back now to the bigger picture of the hookworm here, to me, they almost resemble leeches in a way.
That's a good way to put them. They do, and they can suck a tremendous amount of blood, cause a lot of irritation to the inside of the intestinal lining, vomit, diarrhea, anemia, all those types of things.
Yeah, I'm not sure how well you can see at home, but there's like a head that is attached, and there's a little bit of blood around.
That's
each
right,
one.
and they essentially suck blood.
Okay.
And one or two aren't going to suck enough blood to make you sick. But if you get a ton of them in there and a small animal, that can certainly do it.
Okay. You know, I flipped the page and I saw heartworm, and we talk so much about heartworm. We've had the jar on with the heartworm, and I think that's glaring. But these things, while perhaps not fatal a majority of the time, like heartworm
Correct.
would be, they can do the same amount of health damage to your pet until they're taken care of.
Yeah.